following module will present very useful information on basic pod staffing. This learning tool will explain the pod staffing positions, roles, and responsibilities using a standard organizational chart that we are all familiar with. Before we examine the organizational chart, some basic pod concepts will be outlined. The 5 main operational areas in a pod are greeting or triage, registration and education, medical screening, medical evaluation, and dispensing. Each of the 5 operational areas or stations in a pod is supervised by a chief. The chief is usually responsible for 5 to 6 persons, but no more, based on the principles of span of control. The reasons for this will be explained shortly. Each chief reports to the pod manager. There is one pod manager and a backup during a working shift. Besides the 5 operational areas just mentioned, there are 6 positions that report to the pod manager. They are the clinic chief, the logistics chief, the pod administration chief, the communications chief, the safety chief, and security chief. These are called core management positions and are listed. The material that will be presented next will focus on these 6 core management positions. Persons in core management positions have previously taken basic pod training, followed by what is called Incident Command System or ICS training. The ICS concept is a national standard that evolved from firefighters using the National Incident Management System, or NIMS for short. These training resources are provided at the end of this module at no cost. Let's take a look at a pod organizational chart that illustrates the concept of the Incident Command System, or ICS for short. The organizational chart that you see before you shows all the positions needed in a full-scale pod. As many as 60 persons may be needed to operate a pod, depending on whether vaccines or medications are provided and the number of persons to be processed per hour. Remember these 2 points. At the pod, one person is assigned to a particular job role depending on their prior experience or work background. There is no multitasking of roles by any individual. The other key aspect of ICS is that everyone answers or reports to one chief. At the top of the chart are the core positions previously mentioned. A bit down and on the left is the clinic chief and the clinic support staff. On the right side is the logistics chief and logistics support staff. Each box has a specific job function that is outlined on a sheet of paper. This is called the job action sheet that is provided to each worker or volunteer when they arrive to the pod. This sheet lists your job functions and your position. This sheet also indicates who the chief is, along with cell phone contact information. During a work shift, the pod manager will have a list of persons in each of the various positions, including backups. This list will be provided by the administration chief, who is shown in the core staff box at the top of the chart. The information that follows will only be addressing the 7 core management positions. They are the pod manager, administration chief, communications chief, logistics chief, clinic chief, and both the safety and security chiefs. To review, these are 5 of the 7 core pod positions. The clinic and logistics chiefs will follow later. The green box at the top of the chart is the Incident Command Center that is located in another building. The EOC is short for the county's Emergency Operations Center, and the DOC is short for the Health Department's Department Operations Center. Let's look at the roles of the pod manager. The pod manager reports to both the EOC and DOC when they are activated. The pod manager oversees all aspects of pod operations and can stop pod operations if it is found to be unsafe or cannot be properly secured. The pod manager speaks continually with all core management staff during pod operations. This can be face-to-face, using cell phones or walkie-talkies if they're available. Any staffing needs or pod supply requirements are communicated to the DOC by the pod manager. The DOC then arranges for these needs to be met. The other functions of the pod manager are listed here. Please take a moment to review them. The use of forms includes job action sheets for workers and registration forms for patients visiting the pod. The next position we will look at is the administration chief, who was mentioned earlier. Some advanced training is required for this position besides ICS training and basic pod training. The administration chief is responsible for the staff that volunteer at the pod. He or she will maintain sign-in and sign-out roster sheets for time and attendance purposes. Time spent at a pod may be reimbursable under federal emergency response guidelines. Volunteers arriving at the pod will be given orientation training, which is called just-in-time training, or JIT for short. This is done verbally, but visual aids can be used to explain the following: what the scenario is, the pod layout, entrances and exits, work shifts, breaks, and specific job functions that are required. The administration chief will also maintain records for any purchases of material supplies that might be required at the pod. This includes providing food and water to all support staff. Some other functions of the administration chief are listed here. Please take a moment to review them. Some points were mentioned in the previous slide. Any items provided to pod workers, such as vests, walkie-talkies, and the like, are tracked for return at the end of the pod. The communications chief. This position is vital to successful pod operations. Some level of skill is required for this position. There are two aspects of communications. One is within the pod, and the other is with communications outside of the pod, to either the EOC or the DOC, or both. Let's take a look at the communication chief's role. The various types of communication needed at a pod are listed at the bottom of the slide. Items that are missing on the slide are paper copiers, a fax machine, and walkie-talkies if available. The communications chief should have an assistant and a backup. The assistant would maintain internet connectivity for informational update purposes and to monitor emails coming into and going out of the pod. A phone contact list of all pod workers for a given shift should be provided to the communications chief by the administration chief. The 800 MHz radio is provided by the county in order to communicate with police and other county agencies using a secure frequency that is common to all. As stated earlier, a pod must be operated safely and securely, or else it will be temporarily shut down. Let's look at safety and security concerns within the pod. Let's first take a look at the safety chief. A pod-safe environment means the following: free of trip hazards, free of areas that will cause bottleneck of people, availability of an EMS ambulance if needed, availability of first aid supplies if needed, the ability to control anxious patients waiting in line, ensure that staff are free of fatigue. In addition, the safety chief ensures that the staff have appropriate personal protective equipment, or PPE for short. Examples are face masks, hand disinfectants, and latex gloves. All workers should be wearing colored vests with labels to identify their roles, not their names. Finally, the safety chief interacts with the security chief, who is the liaison to local law enforcement. Obviously, both of these chiefs report to the pod manager. However, the safety chief must have open communications with the pod security chief. Let's now look at pod security. This slide addresses the security chief. The security chief is not a law enforcement officer. He or she is a liaison to local law enforcement and must have an open communication with them and the pod manager. The security chief tours the pod facility, checking for breaches in doorway entrances, for example. Unexpected confrontations between pod workers and pod patients is communicated by the safety chief to local law enforcement, who are in the pod to assist. In summary, here again is the pod ICS organizational chart that we have been discussing. Now we will look at the last two core management positions, which are the clinic chief and the logistics chief. Shown on this slide is the clinic chief and the various support staff positions. This area of the pod is where medications or vaccines are administered. Most staff in this area are medically trained. However, the medical screeners and triage staff do not require medical training. An algorithm sheet with predefined questions that require a yes or no answer from the patient is provided to the staff along with their job action sheets. The EMS position at the bottom of the chart is for a staff worker who can request an ambulance in the event one were needed. Note that there are 6 positions below the clinic chief, which is consistent with the ICS concept mentioned earlier. Now let's look at the clinic chief. The clinic chief oversees all clinical operations at the pod and reports to the pod manager. The 3 main clinical areas are listed. The clinic chief monitors supplies consumed and needed. He or she also monitors staff for fatigue. Support staff in this area can be relieved by replacing them with persons who have been previously identified as backups or floaters. Adjustments to patient flow are first communicated to the pod manager, who may assign additional staff to this area. Or, the pod manager can communicate with the flow control chief to adjust flow. The flow control chief is in the logistics section, which will follow shortly. Additional roles of the clinic chief are shown on this slide. Please take a few moments to review them. Some of these functions were previously mentioned. Returning to our organizational chart, we will now look at the logistics chief, which is the area on the right of the chart. The logistics chief is the last of the 7 core management pod functions. There are 5 chiefs below the logistics chief, as shown on the chart. This area of the pod is non-medical and supports the logistical operations of the pod. Positions below the logistics chief will not be described in detail. Except for the mental health and crisis team members, persons in these positions do not require medical training. Job action sheets explain the activities required for each job category. Now let's take a look at the logistics chief's roles. The logistics chief oversees all logistical operations in the pod. These include flow control, pod supplies, providing educational material to patients, the registration or form filling out process, and mental health issues. The latter usually relate to stress or anxiety of some pod patients. Like the clinic chief, the logistics chief monitors for supplies needed. He or she also monitors staff for fatigue. Support staff in this area can also be relieved by replacing them with persons who have been previously identified as a backup staff or a floater. Additional roles of the logistics chief are shown on this slide. Please take a few moments to review them. Some of the functions were previously mentioned. This concludes the module on pod organization that follows incident command system protocols. During an operational pod, it would be most useful if a similar organization chart were posted on an easel at the pod manager's location. The chart boxes would show the names of the persons assigned to the various roles, while the pod is operational. Behind the scenes, the administration chief would also be preparing a new org chart for the next work shift change. Once the pod opens, then all the boxes on the organization chart disappear as support staff disperse to their pod areas. That is why color-coded vests with role labels is important. Please take the time to view the video clips on setting up, running, and breaking down a pod. Then the importance of ICS will be realized. If ICS is followed, with each person communicating with their chief, then any unforeseen or unexpected circumstances can be easily managed. This will ensure a safe pod that can meet throughput demands for large numbers of patients requiring either vaccine or medications.